America's healthcare system is already on the brink of collapse, but the cuts to Medicaid and Medicare that Republicans have been pushing through the last 2 nights in the middle of the night will cause total chaos. My name is Lex. I'm a nurse. I am quite literally waiting to go inside for my shift this morning, but I really feel like everyone needs a little bit of context as to why this matters and why this is so catastrophic. These cuts, and the cuts are in total over $1 trillion to both Medicaid and Medicare, will cause sheer and utter chaos in our healthcare system. Now, they want to cut over $800 billion to Medicaid alone over the course of 10 years. What does that mean? So that's roughly 10% of Medicaid's budget. Every year, Medicaid has around $800 billion to spend. So if you cut $800 billion in 10 years, that's 10%. Medicaid is the largest reimbursement of nursing homes, okay? Without Medicaid, and any cuts to Medicaid means your grandma and grandpa and your parents are going to be neglected in their nursing homes. And I'm not saying that because the staff is at fault. I'm saying that because when budget is cut, nursing homes cut staff. Right now, today, as I'm making this video, nursing homes are already making nurses take care of 30 to 40 patients. We can't be everywhere at once. Those ratios are about to grow. So a 10% cut to Medicaid does mean that there will be massive neglect in our nursing homes. It also means that some nursing homes are going to shut down completely. And that means that the hospitals you and I rely on, every single hospital in this country is going to have a delay getting people out of the hospital. People are going to sit and wait for discharge because a lot of the folks that come into the hospitals need to discharge to nursing homes, whether it's for rehab or long-term care or whatever. That's not going to happen. They're already full. The nursing homes are already full. Now they're about to get their budget cut. We are not going to be able to move people out of these hospital beds, you guys. And that means catastrophic levels of delays in care for everyone else. I don't know how much clearer I can be. If there are no hospital beds, there are no hospital beds. That means no beds for your car accident. Sorry, you come in with a broken femur and a broken pelvis. If we don't have beds, we're not going to treat you in the parking lot. We legally can't do that. So this is going to affect everybody. Private doctor's offices who primarily take Medicaid patients. If you go to that doctor and you don't have Medicaid, if they shut down, does it matter? Does it matter? Simply put, the disabled and the elderly are going to die because of these cuts. And Republicans know that. They know that that's why they're doing these votes at 1 in the fucking morning. They know that only 15% of Americans, regardless of political belief, 15% support Medicaid cuts.
America's poor, especially the elderly, are bracing for a healthcare storm. And it's called the One Big Beautiful Bill Act. The name sounds nice, but behind it are some brutal realities. Trump's bill is set to slash over $1 trillion from Medicare and Medicaid, and experts say that means up to 11 million Americans could lose coverage in the next decade. That's not just numbers on paper. That's seniors losing nursing home care, low-income families losing their doctor visits, and children losing their safety net. So what's inside this so-called beautiful bill? First, work requirements. Able-bodied adults on Medicaid, ages 19 to 64, must now prove they're working at least 80 hours a month volunteering or enrolled in school. Miss the paperwork. Lose your coverage. Critics say this isn't about accountability, it's about cutting people off. And here's where it gets darker. There's talk, half policy and half rumor, that Medicaid recipients could be pushed into farm work to replace immigrant labor. Imagine being poor, sick, and told to pick crops just to keep your health insurance. It's no wonder Americans are at it again on what they know how to do best, rant and push back on social media. And I get it. It seems it's the only option we've got to make our voices to be heard. Here are more tips.
I just came out here to tell y'all that I work for Medicare. And the changes that Trump is making, oh dang, can I probably not say his name? Anyways, the changes that he's making is real life. They are cutting people's Medicaid checks, no letter, no explanation. They are increasing their Medicare coverage premiums. They're it's like the only result is that they're trying to all the elderly. I literally had a man that was getting a transplant, got the clear on Friday. Yesterday on the 1st, they cut everything, cut his Medicaid, cut his SSI. He can't get anything. So he cannot get his transplant. In 3 days, that made a change. Like, check on your grandma, check on your grandpa, your mama, your daddy, because they going through it. And it's really sad.
Y'all need to check on your grandparents because they're not okay. Let me tell y'all what the fuck is going on. So, for example, these are examples and what I'm dealing with my elderly mother. My mom was getting 1,200 and some change from SSI. My father worked as a nurse, amongst other things, his entire life. For when he passed away, to pass it on to my mother, who can now live off of that because she was a housewife for 3 kids our whole lives. So now let's do some math here. She got $1,200. The average rent probably for a 1-bedroom is about roughly what, $900, but we'll say $980. Now I applied for her for food stamps. She gets $23. So we do $980, take away $1,000 and some change, and what do you have? Leftover money for the light bill, maybe even a phone bill. Hell, I don't know. It definitely ain't enough for a Snickers. But here's the problem. They're charging her now for her Medicare. So now she went from $1,200 to $707 because they're charging her for her Medicare. Do y'all hear what I'm fucking trying to tell y'all? How? Who? You can't live off of that. They can't live off of that. Our elderly community and disabled community is going to be all living on the streets and in their cars. The homelessness in this country is about to go up significantly. Y'all go check on your elderly because they're not okay. They are struggling.
Donald Trump, did you see the man from West Virginia that called into C-SPAN complaining about the price of insulin that has gone from $8 under Joe Biden to $80 under you for those on Medicare? I mean, Donald Trump, really? MAGA, is this what you all planned on and this is what you voted for? You voted to raise the price of insulin for those that get it. This was a 28-day supply. And under Biden and under the medical play, the way things were written and reimbursement rates, etc., that it was $8 when Joe Biden was president for a 28-day supply of insulin. And now it's gone to $80 a month. Now, if you're on a fixed budget, the difference in $8 and $80 is $72 a month. Times a year is almost $1,000. It's roughly $900, give or take, but it's close. But it's a huge number. This is not what people voted for. MAGA, you're going to FAFO. You've messed around. You're going to find out. You're going to see what you voted for is not what you're getting. Love to hear from my Democrats, my MAGAs, my crazies, my cuckoos, and my burned out light bulbs. Anybody that also uses insulin and you think...
Hello, my fellow Americans. I just like to understand if everybody here understands what filial laws are. Because frankly, if they do pass this budget bill that they're talking about passing and Medicaid gets basically defunded to the tune of like $1 trillion, well, hospitals that rely on that funding and nursing homes that rely on that funding, well, they're basically going to have to go back to privatized care. And if they go back to privatized care, well, I'm going to be honest with you, a couple shareholders are going to get rich. Our claims are going to get automatically set to denials. And, you know, we're going to be on the hook financially because filial laws. And filial laws are applying in like 30 states, so you should really understand what that's going to mean for you, because basically it's saying that they can hold you civilly or criminally liable for not paying for your elderly parents and or in some cases grandparents medical care. Okay, in my situation, you may only have one living parent left, and he might have been an abusive piece of shit because he was an alcoholic and an addict, and honestly, you might not want to do that. You might rather want to go to jail than do that. So frankly, I think everybody should understand what it is that these people are voting for. And I know a lot of people were concerned about overtimes and taxes and taxes on tips and things. That's just the tip of the damn iceberg when it comes to this bill, okay? And a lot of people that are voting for it haven't even read the whole thing. They basically said that, okay, which I don't understand how that's even possible, because I know in my past position, if I didn't read a contract but I bound the company to it, I'd be held fucking liable for that shit, okay? So I would just like to understand what it is we're all doing. And I would also like to understand why it is that MAGA Republicans seem to think that it's okay for their leaders to lie to them. because they said they weren't going to cut Medicaid funding, and they also said that they weren't going to, enact Project 2025.
The impacts are already being felt. Rural hospitals, which rely heavily on Medicaid funding, are warning they could lose over $130 billion in the next decade. In states like Kentucky, dozens of hospitals are preparing to shut down maternity wards by 2027, leaving pregnant women driving hours just to deliver safely or better, still deliver right from home or risk bankruptcy. And for the elderly, this means nursing homes under pressure, caregivers stretched thin, and thousands of people at risk of losing access to basic long-term care. It's raw, it's emotional, and it shows just how disconnected this bill is from real life. Just listen to this first-hand accounts of this bill's impacts.
Story with you because I need you to know that this is happening. Of course, identifying details changed, but so I'm an OBGYN, and a few years ago I had a patient come in who had opted to have a home birth. And the reason she chose it was because she knew exactly how much it would cost, $2,000. And she said, I can pay that. She did not have insurance, and she was too scared that she would go bankrupt if she tried to have a birth in a hospital. And I get it. The average C-section costs $35,000 in this country for uninsured people. So she knew. The problem is that during her home birth experience, things were not going well, and she needed a C-section, and her home birth midwife was trying to have her come into the hospital. She delayed for hours because she was scared not of needing a C-section, but because of how much it would cost. She finally came in, and I met her, and the first question was, how much is this going to cost? How much for the spinal, for the blood draw, for the operating room, like how much? And I'm sitting there helpless while I'm watching her baby not do well. And don't come at me and say, oh my gosh, how could she care about that? She cares about that because she's an American and she's paying attention, and she knows just how much she could lose everything. And eventually we do the C-section, and the baby ended up being fine, but would have been a lot better if it had been done sooner. And she ended up hemorrhaging and needing blood transfusions, which, yes, cost money, but are also risky things she could have avoided. The next day, rounding on her, and I was like, I need to check your blood count again. How much is that going to cost? My heart broke for her. So here's the thing. This is a horror story, but this is healthcare in America. And for people who are on Medicaid, she wasn't, but for people who are on Medicaid, which, by the way, is the biggest payer of all births in this country, they're going to lose that. I can tell you, more and more people are going to do exactly what she did, which is not get care, not get prenatal care, not birth where they would have chosen, because they're so scared that they're going to lose everything financially. And Republicans are just okay with that. I felt helpless in that moment. But the reason I'm sharing that story today is because I know stories can change things, and I need you to share your stories too. And when we do that, we feel less helpless. So I have and you can share yours too, and we need to, because I know we're ringing all sorts of alarms, but this one is huge. $1 billion of cuts to a program that pays for people like this who could have benefited then and would benefit now. So she doesn't have that nightmare. We don't have that nightmare. I think is worth.
Trump promised a healthcare plan that would be beautiful. But for millions of struggling Americans, it's looking more like a nightmare. So what about you? If you or someone you know is on Medicaid or Medicare, how are these changes showing up in your life? Are hospitals in your area shutting down? Or are you already dealing with tougher paperwork? Share your experience in the comments, because this is a fight that affects all of us. And because I know this video hit the nails right on their heads, please show some love. Hit that thumbs up, share this video with others, and subscribe if you haven't already. And remember to turn on the bell. That way, you'll always be right here with us when the next video drops.